via Zoom. And we just pray, Lord, that you will orchestrate everything for us tonight. And as we conduct this Zoom meeting, we lift up to you our two speakers who happens to be our classmates as well. We lift up to you Dr. Jesse Ang and Dr. Tony Cusi, who will be giving us talks tonight. And we just pray, Lord, we just pray that you will allow them to speak to us very fluidly with all the message that they would like to impart to each one of us. And so, Lord, we thank you once more for this gathering, and all of this we ask in Jesus' name.
Amen.
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 Um, Paki-mute lahat at para makapag-umpisa tayo. Sino mag-umpisa pa kaya?
Kunet.
I think I will be starting the meeting. So I was assigned to give a talk on anxiety. So I can start on that topic. You know?
Okay.
So the question, how do you define anxiety? Anxiety is, uh, is considered an intense feeling of worries, fears of everyday situations, and there are two types that we consider emotion-wise. There's the free-floating anxiety, where we are always being consumed with our daily living. And then there's the anticipatory anxiety, where we worry of an impending uh, or imminent event, which is possibly with an adverse outcome. So we're worried about something that's going to happen that's bad. Because if we are anticipating something good happening, of course, we are not going to worry or be anxious about it. We are looking forward to having those feelings. So, what what are the symptoms when you have those intense, persistent worries and anxiety? Some of the symptoms that accompany anxiety are mostly what we call autonomic hyperarousal. What does that mean? Those are symptoms that are automatic. We normally don't know or feel or experience breathing. When we breathe, we go on with our daily life, and we are not aware that we are breathing, or we're having our hearts beating. We don't experience that. But when we're anxious, we become more aware that our heart is racing, our pulse is raising, our breathing goes up, our blood pressure goes up. Um, we sometimes get paralyzed, our sleep is disturbed, and a lot of times there is a rush of adrenaline. And the reason why the rush of adrenaline happens is to make sure that we get enough oxygen, because when we're not breathing properly, or we're anxious, uh, our oxygen supply to the brain can get us paralyzed. So it's our body's way of compensating for that. So what are the different causes of anxiety? Of course, there's genetic causes, where we inherit all these things from either either side of the family or both sides of the family. Personal situations that make us very anxious, like a death of a loved one, especially the ones who, if this loved one is the one giving us reassurance of what's going to happen to our future, like the death of a parent or a spouse, job stressors that makes us anxious, especially if your job security is online, medical conditions like thyroid issues. A lot of medical conditions like hyperthyroidism can cause anxiety symptoms. Um Trauma. is a very common cause of anxiety when we have experienced or perceived anxiety. Now, you must have heard of a phenomena called fight flight phenomena. Uh, a fight flight phenomena is when we see a perceived threat or an imminent threat that is going to happen. So what happens during that time? We either we confront that threat, or we run away from the threat if it's too much for us. And it's hardwired in our brain to protect us, from any danger that we perceive. So if we perceive that there's a danger that's happening, we either confront or we run away from the threat. It is there hardwired to protect us. But as we uh, continuously experience those anxieties, those there are two parts of our brain, the hippocampal area and the amygdala, that is involved in the fight flight phenomena, that increases in volume, just like a muscle that's getting exercised. They increase in volume, they increase in mass. So those who are constantly experiencing like traumatic experience in their lives, or you're genetically born with more volume in your amygdala and hippocampus because you inherited anxiety in in either side of the family, you are more prone to have anxiety symptoms. Why is that? Well, because your those two parts of the brain is already primed to have those symptoms that we I just mentioned. Uh, so what are the different types of anxiety? There is what we call social anxiety. There are people you will meet who will tell you, when I'm in a social gathering, I I feel like my heart is racing, I'm breathing hard, and I feel like I'm paralyzed. I can't talk. I I um, I feel like passing out. Um, and then there's what we call social phobia, which you develop because of social anxiety. If you're constantly exposed to a social situation and anxiety, you eventually develop social phobia. And there's also the separation anxiety. If you are attached to a person, when that person leaves your presence, you become extremely anxious. It's mostly common in children when they're used to being they're very attached. Most of the time, most of those who suffer from those are shy to begin with. They're introverted, and with constant social anxiety and social phobia, they develop what we call agoraphobia. You begin to avoid going to social gatherings, to situations where you're exposed to people, and then you become homebound and you develop agoraphobia and fear of going to places where there's a lot of people or a lot of situations that could trigger those social anxiety. Then we have what we call a panic attack, which develops during those situations, or a panic disorder. It's a more intense uh, feeling of anxiety. During that time, there's there is a, a situation of panic. When that happens, a lot of times some people think they're having a heart attack, and you see that in the emergency room. The emergency room physicians will always encounter this, and the first thing they try to rule out is, are you having a heart attack? Because they have a feeling of heaviness on their chest. Then, of course, another one is constant exposure to trauma, and what we develop what we call post-traumatic stress disorder. And I think we're experiencing that around the world after COVID. A lot of people are traumatized. Sometimes you don't have to experience the trauma yourself. Let's say some people have experienced abuse from a loved one or from a caregiver, or they were in a situation that was very traumatic, like a car accident, but you don't have to experience it directly. Some people get traumatized just hearing information or bad news. We have seen people who suffered from post traumatic stress disorder who were just exposed to news about trauma that traumatized them, and they do meet the criteria for post traumatic stress disorder. And then we have another severe type of anxiety called obsessive compulsive disorder, where you start having these persistent thoughts, obsessive thoughts. And there are two types of obsessive thoughts. One is constant uh, fear of infection or contamination. And then another obsessive thought is a feeling or obsessive thoughts of something that is not being taken care of. Like, did I lock the door? Did I turn off the oven? Did I turn off the light? And so when you have these persistent obsessive thoughts, it's followed by compulsion, and the compulsion is to correct the obsessive thoughts. So what do you do when you have fears of germs? You have a compulsion of washing your hands. So we have people who are constantly washing their hands or using sanitizer. That's the compulsion of contamination, of obsessive contamination, obsessions and thoughts of contamination. And then there's the obsessive thoughts of neglecting something or missing out on something. So they think, oh, I miss turning off the light. Oh, I miss locking my door. Oh, I miss feeding the dogs. So you're constantly observing that they're constantly checking through compulsive behavior if the door is locked, if have I turned on the lights, and it impairs them. They can't go on with what they do because they're constantly checking. They can't do any other tasks. So these are the different types of things that we experience. Now, there are different levels. There's the mild, the moderate, severe, and then, of course, the most severe of all of them is when you start having panic attacks, because that brings you sometimes to the emergency room. So now, having said that, what should we do? Well, there are certain things that we can do to stop it, because anxiety disorder cannot be cured. It's not cured. It cannot be cured, but it can be treated. We have many things that we can do. Some of the things we can do is a change of lifestyle, uh, exercising, well-balanced meal, um, getting adequate sleep, uh, ex- deep breathing, prayers, meditation, listening to music, dancing. Mindfulness meditation has become very popular here in the States. Even some of the big university, Ivy League universities have started their incoming freshman years, teaching them mindfulness meditation. It started in Harvard and Duke University, where incoming freshmen are given courses on mindfulness meditation to deal with the stress of college life, and then surrounding yourself with friends and loved ones, which we're doing right now. And lastly, we can also use medications and what we call cognitive behavioral therapy. We'll talk in more detail some of those things. But there are some other things we can do. Uh, like I mentioned earlier, a dietary change, well-balanced meals. Then, of course, there are uh, some herbs, teas that can help. Zinc has been found to be very effective, not just for preventing COVID or preventing viral infections, but has been found to be helpful for anxiety. chamomile tea, valerian tea. Uh, Eggs are rich in tryptophan, which converts into serotonin. Milk is rich in tryptophan, or tryptophan, which also has a very calming experience because it increases serotonin. So those are things that we can do and add to our diet. It's nice to start the day with some eggs, like they say, and some valerian tea or green tea, because they also contain uh, calming effects on your anxiety. Milk, turkey. That's why after you eat turkey on Thanksgiving Day, you feel sleepy because you induce tryptophan, or tryptophan increasing in your brain and your system. So those are the things we can do. And then, of course, there is what we call traditional medications that we use in psychiatry. Uh, we have used um, an agent, a serotonergic agent, which works as a partial agonist called buspirone. Um, it is indicated only for anxiety. Then we also have old antidepressants called tricyclics, which fortunately I was exposed to using that when I was in training. Another one is called what we call MAO inhibitors or MAO inhibitors that has come out of fashion nowadays because you have to change your diet. There are certain dietary restrictions when you are on MAO inhibitors, but it's very effective for anxiety. The most common ones used now are SSRIs or serotonergic reuptake inhibitor agents like Prozac, Zoloft, Celexa, Lexapro, and some SNRIs like Prestige. This venlafaxine. Venlafaxine is one of an SNRI that has an indication not just for depression, but for generalized anxiety and for premenopausal or menopausal anxiety. Um, Another one that, of course, we usually use before we use medication is what we call cognitive behavioral therapy. Um, what is cognitive behavioral therapy? Cognitive behavioral therapy is challenging some established thought patterns that has made us very anxious. Like I mentioned earlier, when you perceive something that is going to happen, an imminent threat that might happen to you that has adverse effects on your or livelihood or your living or your loved ones or your personal health, like if you are told that you might have cancer or you might have this and you might have that, then you start worrying, how long will I live? How will I survive? What will happen to my loved ones? So sometimes these perceived threats can cause anxiety, and cognitive behavioral therapy has been very helpful. It challenges some of the thought patterns that you might have developed because it might just be a perceived threat and not really a true threat. So they have done it very effectively. It's a short course of treatment, usually lasting 6 to 8 weeks, and has been very helpful and has been used quite a bit if a therapist is very experienced in using cognitive behavioral therapy. Um, so those are the things that I would like to share with you all on anxiety disorder. Are there any questions that you would like to ask, or maybe stories that you would like to share?
If you want to share or ask a question, just unmute and you can throw the questions.
Let me add something. It's a segue for Doc Jesse's talk. A lot of anxiety disorders usually start early on, especially those who inherit that. If there's a genetic predisposition, you normally see it in the young population. Although they said that 30% of the time we have experienced some form of anxiety in our lifetime. Up to 30% of the population have experienced anxiety. But most of the time, especially when I was involved in research programs, it's very hard to find people who are older who only have generalized anxiety. Most of the time, in mid 20s and above age group, they not only have anxiety but they also have depression. So what does that mean? That when we were looking for research subjects, we have to go to colleges and high schools because that's where you can still see cases of pure patients with or individuals with pure anxiety. Because when you are doing research, it has to be just pure anxiety to do the clinical trials. If there is an accompanying comorbid condition like depression, they are excluded from the study. So we have to go to the younger population. What we found out is those who have anxiety and were never treated during the time they were exhibiting the anxiety symptoms, they could easily develop in their mid 20s to late 20s beginning depression. So it's very important that you start treating a lot of these uh, individuals who start getting anxious much earlier to prevent them from eventually developing depression. And Brother Jesse will talk about about the topic of depression after this. If there are no questions, I will just go ahead and segue straight to Dr. Jesse's talk. Any questions? Tony, you don't have a sound coming out.
Tokayo, ulitin mo yung kung meron ka sinabi kanina, ulitin mo kung meron kang tanong kay Tony. Cusi.
Yung ano, yung anak ko baka magamit niya sa mga seminar niya dito sa Pilipinas. Pwede siya magtanong, baka hindi niya alam.
Oh, yeah, sure, of course.
Nak, you can ask question, anak.
Nikki, you can ask any question. We will try to
Yes,
answer.
of course. I will. I'm just listening for the time being. Thank
Okay.
you.
Okay.
Okay.
You can
So-
share with us your experience in the local, there's a big surge here of anxiety and depression during the COVID, especially among the young people, because they were looking, what will happen to us? Our classes were suspended. Now we're just doing things at home. Will colleges and universities I was accepted in, will it ever recover? Those things happen to those young people. They're all tied up. They don't know what their future is. They almost compared it to the young people during World War II when they didn't know what will happen to the world, And this was a phenomenon that I think we have seen worldwide. What will happen to my future? I'm still young. I haven't started life yet. And so this phenomena has really increased here. And so that's all I can add before Doc Jesse starts his talk. Anything else that you would like to add or maybe share with us, Nikki, with your Philippine experience?
Yeah, I think
That
Nikki is
also?
Nikki is
Yes.
raising her hand.
Okay. In addition to what Sir Dr. Cusi said, uh, in the Philippine setup, yes, anxiety is evident. However, the thing with anxiety in the Filipino setting is that it goes on undiagnosed for a long time because we Filipinos are naturally resilient. So most Filipinos don't think of anxiety as something that we have to think about or it's something that we experience because sometimes we we think about it as pag nagdadaanan ko lang yan. It's something that we normally experience in our everyday lives. Kasi nga mga Filipinos, 'di ba? Bahala na. Yung mga Pilipino nararamdaman lagi na maliit na problema lang yan as compared to a lot of our Western counterparts. So most of the time, anxiety goes unnoticed in the Philippine setup. And magugulat na lang sila parang, do I have a disorder or baka mamaya mahina lang ang loob ko. So that's the way of thinking of Filipinos.
Yeah.
But related to what Dr. Cusi also said, that anxiety is a worldwide problem. We do acknowledge that because the World Health Organization also coined the term pandemic fatigue. And we also have what we call the post-COVID stress disorder. So the World Health Organization has already acknowledged the fact that this is a global emerging pandemic. So after COVID, there is another pandemic that we have to think about, and that is related to mental health.
Yeah. The advantage of Filipinos that we don't have in modern countries like the US is, like you said, being resilient because, you know, we're used to hardships and we overcome hardships easily. Tsaka mababa ang kaligayahan ng Pilipino. We can easily get cheered by small, simple things, you know? We're not as as sophisticated mentally that the sophistication almost interferes with our lives. So we you don't have that. Plus, we're still close to each other. Like I mentioned earlier, some of the things that can be used to help anxieties to be around your friends, because when you're having a good time, having happy, especially on the golf course, when you're on the golf course with some of our classmates, all their worries go away. You know, when you're around friends, kahit yung mga luma niyong kaibigan, when we're around friends, nagbobolahan lang tayo, paulit-ulit ang kwento, pero masaya. Di ba? Paulit-ulit lang. Yun din at yun din ang pinag-uusapan, pero we get relaxed. And see, we have family support too. You know, we're closer. It's closer distance. Samantalang, let's say I have family, but they're all located in different sections of the country. And, you know, we even have time zones here where they're 2-3 hours ahead of us and those things. So that's why, and there's also still a stigma with mental illness that has been eliminated here in the US because of the media, more aggressive education in schools and universities and the media about the presence of mental illness. And I think the Philippines will catch up eventually with that. Like you said, the World Health Organization has recognized it and they will start teaching it in schools. When we were in med school, when I was with Jesse, with Doc Jesse, even though Doc Jesse went into neurology and psychiatry, even in the Philippines, not much has been. That's why now residency programs here are separated. Before it was integrated, neurology and psychiatry. But now it's a subspecialty by itself. So anyway, any other comments you want to share? Any comments that will help us? Sabi no, we have a classmate. He said that he experienced only increased pulse rate and rapid breathing when he's around pretty women. You know who I'm talking about, Tony. That's your old friend.
Anyway, I would like to ask baby Nikki. So it's quite difficult to screen patients who are suffering from anxiety in the Philippines.
In a way, yes.
Mhm.
I think it's also partly due to the fact that Filipinos don't usually seek medical help unless they are experiencing something else. Like for example, hindi ako magpapatingin hanggat wala akong nararamdamang kakaiba. And the thing about mental illness is that it doesn't have any physical manifestations.
Right.
So it's hard to diagnose most often than not, if a person experiences anxiety here in the Philippines, they would go to the medical emergency room. They might feel na baka inaatake ako sa puso or baka may problema ako sa blood pressure. Okay, without thinking that maybe it is a mental issue. They don't recognize it as of now. Okay, so it's challenging in that aspect po. But fortunately, I think the Philippines is one step forward when it comes to dealing with mental health, since it's one of the roadmaps of the Department of Health. So we are capacitating our communities towards improve information when it comes to mental health. So we're trying to also reach the far-flung communities in informing people that mental health matters and that mental illness is not something that should be stigmatized. O kahit pa paano po na papalawak na po natin yung kaalaman tungkol sa mental health, we are doing our part right now.
You know,
Right.
there's in addition to what you said, Nikki, here in the States, I have two friends who are professors at Duke University, and they conducted a very good inpatient study at because they manage the VA hospital here in Durham, North Carolina, and these two guys did the research study. They were there for the inpatient setting in the medical floor. They found out that those who have medical illnesses like severe diabetes or heart attack or everything like that, they stay 2 weeks longer as an inpatient if their anxiety and depression are not treated properly. So they stayed 2 weeks extra compared to those who were treated with their mental illness. They got better faster and sooner. So it also put less burden on the medical services if you treat anxiety and depression or any form of mental illness earlier. And this was a big study that was done here in North Carolina, and that was published in journals for not just for psychiatric journals but for medical journals. That way, primary care physicians and providers will be aware that we cannot ignore mental illness. Oh, we'll just refer them to this or this, that. Oh, don't worry about it. Let's treat you first. Because no matter how much you try to treat their medical illnesses, they won't get as fast better without treating the accompanying or underlying mental illness or anxiety and depression, for that matter.
Yes, doctor, that is actually a very good study, and it is going to be a breakthrough sooner or later, especially that we have what we call somatic disorders. No,
Yeah.
sometimes we have patients who feel that they have physical illnesses, however it is all in their minds. So I think that is also a manifestation of anxiety, or perhaps
Yeah.
somehow the same
Especially
as
young
anxiety.
kids. I'm a child and adolescent psychiatrist too. So we see that in kids because they're not sophisticated yet to identify emotions and feelings. They cannot verbalize what they feel. So it's easy for them to say, I have a belly ache. And for those who find that having a mental illness is a stigma, lalo na sa Pilipinas, it's easier to get help if you have something else that's happening. Oh, I have a migraine. Oh, I have a chest pain. Oh, I have a belly ache. You know, it's easier to get medical help uh, they get more attention medically if you're saying something like that versus I have anxiety. Mahihiya ka naman dyan. Di ba uso sa atin yata? It's seen as a character flaw instead of seeing it as a medical condition. Yeah. Any more comments, additions, questions that you would like to ask? Please feel free. This is for our own education.
Huwag na kayo magtago.
Sige, thank you. We can, after Dr. Jesse's talk, we can open it again and maybe
Yeah.
you can share some more. And maybe some of our classmates might eventually join us too. Okay,
Okay.
let me introduce our class valedictorian, a good friend of mine from the time we were both altar boys in Letran.
Totoo yun.
And I was the one of the campaign managers of Jesse when he became the very first UST student body president. That's his history. That's history. He was the very first one. So here, let me introduce you our high school valedictorian and a good friend that I consider a very good friend, Dr. Jesse Ang from Washington.
Maraming salamat sa iyo, Ton. Kasi, alam mo, muti na ako di makatuloy sa discussion kasi Tom just told me hindi daw maandar ang kotse sa trabaho niya. So I was about to excuse myself, pick him up. But unfortunately, gumana ang kanyang kotse, so he's on the way home. So I was in a emergency panic mode. Just time talk ni Tutlet, but I was able to speak early, and my son told me, "Don't worry, the car is moving." So now I can be able to stay with you, and so I listened to the talk of Tonet, and very good discussion. I mean, I agree with him that anxiety, there's an overlap, eventually becomes depression. But an interesting topic, because the reason why we have this talk is because of the fact that we still cope with the crisis that seems to affect the emotional, physical aspect of also spiritual aspect of our lives. So it's been about 2 years since we had this COVID-19, and that I gave a talk a few months thereafter. And at that time, the data was indicating that we only had more than 100,000 Filipinos who had been sick, infected with COVID, and we only had less than a few hundred casualties. And at that time, the United States was affected with only less than several millions. And now, 2 years later, we have been hit by so many variants, and the Philippines has been hit with 1.5 million cases and about 50,000 casualties, and the United States has been affected with 700,000 casualties and 50 million cases of COVID. So we are now still in the times of uncertainty. The fact that we have this particular issue about still trying to recover from the economy, the impending Omicron variant, and also there's massive tension going on in the other parts of the world, Russia and Ukraine, Taiwan and China, and also these upcoming elections causing us a lot of apprehension, worry, uncertainty, and also at some point, some people will get depressed. The main issue that we are discussing is what is depression? When will be sadness turned into depression? What causes depression? How can we be able to survive not being clinically depressed in this particular time of pandemic? So the first things first is that it's not abnormal to feel sad when we're faced with a disappointment, loss, or uncertainty. So ang ano yan, it's normal na tayo o mag-alala tayo kung meron tayong problema na dumating sa atin na hindi natin inaasahan. Pero pagka ang ating problema hindi nawawala at hindi nalulutas at tumatagal-tagal yan, ang mangyayari, ang ating utak, madideplete ng mga what we call neurotransmitters, sabi na nga nito net, serotonin, norepinephrine, and even dopamine. Pag yan na hindi nalutas at tumatagal yan, eventually ang ating neurotransmitters ay madideplete, and eventually it can lead to what we call depression. So ano mga possible causes of why do people eventually get depressed? So number one, what we call genetic or familial history. So kung meron tayong magulang na may nagkasakit ng depression, likely that you will have about 25% chance of being depressed. It doesn't mean to say that your parents were depressed before na kayo magdi-depress kaagad or sigurado magiging depressed. It only tells you that you have a higher chance of being depressed while people who have no history of depression in the family has only 10% chance of being depressed in their lifetime. Second, ang women are more prone to be depressed than men because marami silang dinadaanan. Meron such thing as postpartum depression. Meron such thing as premenstrual syndrome that will make them make them irritable or depressed. Meron silang mga other causes because marami silang they are much more emotionally able to relate to losses. So kaya women are more prone to be depressed. It's about the statistics about 15 to 17% women suffer from depression, while men suffers about maybe like 10 to 13%. However, ang lalaki are more prone to have incidents of completed suicide. Eh bakit ganoon? Kasi ang mga lalaki marahas. They have a strong issue of impulsivity. They express their disappointment through what we call aggression. And so and the men has a better means to complete their suicide, like they use guns, they hang themselves. So makikita nyo karamihan ng mga lalaki pag nagpapakamatay, ang ginagamit nila baril o they hang themselves. Samantala mga babae, kadalasan ang ginagamit nila ay mga gamot, mga overdose ng Tylenol or kanilang mga gamot sa ibang sakit nila. So likely they are not very lethal and they have more time to ask for help when they have taken an overdose. So yun lang maganda dun sa sitwasyon ng mga babae. They have more attempts but less completed suicide. Number 3, ang history of substance abuse. Kung kayo may sakit sa alcohol, o kayo gumagamit ng droga, o ng shabu, o kaya cocaine, ang mangyayari niyan, ang shabu is called meth, sa crystal meth yan. Ang cocaine and crystal meth, they are both what they call release the abnormal amounts of dopamine from the brain. So pag sobrang dopamine yan, it will give you an initial unusual sense of pleasure. Pero pagka nawala yan, it will also make you significantly depressed. So people who have alcohol or substance abuse are more likely to have more encounter with depression and more incidents of suicide. So pangapat, ang talagang pinaka-importanting reason why people become depressed is because when they have no sense of direction, a sense of hope, a sense of connectedness, they feel alone. So yan ang pinaka-importanting bahagi kaya ang tao nadidepress. Wala silang mapakiusapan, wala silang makaibigan, wala silang papuntahan, mawala silang pag-asa o pananalig. So they feel isolated, they feel like they have no sense of purpose. So malamang na sila maging desperate and they go to depression. How does depression becomes a continuing problem? Unang-una, ang depression magsisimula kung meron kang significant stress. So mangyayari niyan, eventually, if you found solution over time, ang depression nawawala din because there's a cycle of depression, eventually goes away within a matter of months, either because the stress was relieved or the stress continues to bother you, but eventually it doesn't hit you hard. However, as the first depressive episode has left you, when you have another bout of depression, it's more likely na baka hindi na umubra yung coping mechanism mo because nangyari niyan, naapektado na yung mga brain receptors mo at mga brain chemicals mo, na-deplete ang mga chemicals o yung mga receptors mo ay hindi nag-respond sa mga itong mga neurotransmitters. So, pag nangyaring ganoon, bumunta ka sa mga psychotherapists, alamin mo kung bakit nangyari yun, naiintindihan nila kung bakit sila nadidepress. Pero bakit kaya hindi pa rin ako makatulog? O tulog ako. O wala akong ganang kumain. O wala akong ganang makiusap sa mga tao. O wala akong ganang makihalo sa tao. Ano nangyayari sa akin? Ano nangyayari doon ay kasi yung mga chemicals ang nagbibigay sa'yo ng energy, drive, motivation, focus, ay galing sa mga neurotransmitters like dopamine, norepinephrine, serotonin. So kailangan yan magkaroon ng what we call biological response. Anong biological response? Yun ay magamit ka ng mga gamot na nakakatulong sa iyo para may balik ang dati mong levels ng mga chemicals or matulungan yung mga brain function na sinasabi na what they call it brain-derived neurotropic factor. Yan ay nagbibigay ng parang dumami na naman yung mga brain cells, brain tissue na nag-involve sa emotional health. So yun ang nangyayari dito. So kaya patient na nasa therapy for 10 years, napunta siya sa social worker, psychologist. Tapos sabi niya sa akin, alam mo, doktor, naiintindihan ko na kung bakit ako depressed. Pero bakit iniwalayan ko na asawa, binago ko ng buhay, bakit pa hindi pa rin ako bakit pa rin ako I don't want to live. I see darkness in my life. So sabi ko, at that point of time, I just happened to finish my training in University of Washington, and I was involved with a drug known as fluoxetine that came out in the picture, and I was involved in the initial research of that Prozac in University of Washington. That was the first drug that was labeled mga old drugs, maraming side effect. They make them sleepy, like yung mitriptyline. They make them gain weight. Tapos and if taken too much, they die because of cardiac arrhythmias. So with that Prozac, binigay ko sa pasyente ko, and then I saw them a month later. Ang sabi ng pasyente ko, you know what, doctor? I have always, for 10 years, I've lived in darkness. Parang buhay ko parang laging dilim. Pero nabigyan ng gamot ako, nagkaroon ako ng liwanag. Nagkaroon ako ng bagong buhay, ng bagong pag-asa. So, sandali lang ha. Anyway, so, so at some point, depression can lead into chemical changes that you may not respond to counseling. You may need intervention through medical intervention. But ano ngayon ang ating, what is the relevance now to what we're facing with this COVID-19? So kayo, karamihan sa kayo, ay, lalo na tayo sa Pilipinas, hirap na hirap tayo, maraming nawalan trabaho, maraming nakakasakit, namatayan tayo ng kamag-anak. Ako namatayan ng isang bayaw, isang ipag. So it's grieving, a sense of loss. Number two, tayo na sense of isolation. Kunyari, kung tayo na kung tayo hindi pinapayagan, lumabas ang bahay, tayo lagi na lang doon sa bahay na lamang. At some point, doon tayo sa maliit na kwarto, we feel cooped up, frustrated, trapped. So either have anxiety, irritability, boredom, a sense of isolation. Yung mga ating mga anak, hindi makapunta sa eskwela, hindi na makita kanilang classmate. Ito mga ating anak, tuon-tuon pumunta sa may ibang eskwela kasi they want to see their classmates, they want to hear their teacher, they want to sing, they want to draw. Tapos uwi na pero sa quarantine, sa lockdown, nandun lang sila sa bahay, walang magagawa, walang, kung pwede lang, kung TV lang, hindi rin magbigay ng gana yon. So they feel lonely, they feel isolated, they feel disconnected. So that's another issue, a sense of isolation. At tapos wala ka pa ng trabaho, nag-aalala ka, ikaw padre de pamilya, ikaw madre de pamilya. So nag-aalala ka, paano ko pakainin ng mga anak ko? Gutom na, nag-iiyak. So nalulungkot ka yun. Parang you feel a sense of despair. Where will I get my help? Magsisimba ka nga, you pray, pero gutom pa rin ang anak mo, gutom ka rin, hindi ka makatulog. So that's more likely that your anxiety will lead to depression. So ano ang ating magagawa? Ano ang ating magagawa na parang ang ating kalungkutan ay hindi dumaan naman maging parang what we call clinical depression? Unang-una, sabihin natin sarili, na itong problema natin ay meron din dadaan na mawawala din. So this day will pass. We have to tell ourselves, this day will pass. Na itong ating problema ay nakikita naman natin. Sa ngayon, ang COVID ay nababawasan at now nasa COVID level 2 tayo. Eventually, with the grace of God, gagaling. Sabihin natin na and we have to have what we call a connectedness. Yung mga lockdown. Pero look at it as an opportunity kasi tayo busy sa trabaho, hindi natin nakakatawag mga kaibigan, kamag-anak. So this is a time that we try to connect with the people that we have not been in contact with. A long-lost friend, a long-lost relative, maybe a phone call to someone that you haven't reflect. Sabihin natin, siguro it's a time for us to reflect because it's time to ask myself, ano bang na magagawa ko na hindi ko nagawaan before? Alala nyo ngayon, laro kayo na laro ng golf. Pero naisip ba na, baka naman siguro ito pagkakataon na masabi ko sa sarili ko na bigyan ko ng konting pansin naman ng aking asawa na mabait sa akin, nagluluto, sasamahan ako. Pero hindi ko siya napapansin yata. Hindi ko siya nabibigyan ng salamat. thank you for all your help. Or try to date your wife in small ways. Doesn't have to be at the send in the restaurant. It could be a conversation. Ito nangyari sa pandemic nito, it helped me in a way that I have, in a sense, a much more a sense of purpose. Nagkaroon akong direksyon. So I become closer to God and closer to Mary. Because before, I was so busy with work. Trabaho ko noon, siguro, umaga hanggang gabi. Kahit na ako retired at 7 years. Because of this pandemic, that I was able to put some, what you call, a sense of what you call direction. Meron ako parang routine sa umaga, dadasal. Tapos titingin sa stock market, pero hindi naman yung lang ko, dasal muna, breakfast, tapos trabaho. I work 2 days a week. Pero at some point, bitingin na naman ako sa TV about news, pero I try to look at, read or watch a movie that's historical. That's another thing. But number 3, the most important thing you have to tell yourself, instead of looking at yourself, what is wrong with me? What is it that I can do to make a difference, to make someone lessen their sense of pain? Kasi kung nakita mo na ikaw, meron ka pa rin kahalagaan sa isang tao, even though by an act of kindness, makita mo sa tao na kailangan ng lalakad sa kali, o kaya bigyan mo ng piso, 2 piso, makabili isang hamburger, o kaya makatulong ka ng konti, yun ang the feeling of a sense of accomplishment from an act of kindness is something that cannot be bought by anything else. So an act of kindness, trying to get out of yourself to do something, really will make a difference. So yun nga ang nasasabi ko. Pag, ang another thing that you can do, adequate sleep. Kasi kung matama ang tulog nyo, if you have a very good sleep, about 7 hours, 8 hours of sleep, or 6 hours, kung tuloy-tuloy lang, that helps the brain to restore what has been exhausted during the daytime. So kailangan talang adequate sleep para naman ang brain mo, that will be the time na hindi nagagamit ang brain, it only registers memory. So, and then naka-relax ang mga organ system mo. So the next day, you will be refreshed to face the challenges of tomorrow. So adequate sleep, avoid alcohol, kasi kung lasing ka na lasing, o uminom ka ng alak madalas sa gabi, napapansin ko yan, iinom ka ng alak, atukin ka. Tapos para kang hindi magana. Tapos it gives you a sense of, kalmante ka, pero parang there's something, parang hindi tama ang feeling mo. Tapos magiging sa maga because of your frequent alcohol. Avoid substance abuse, use meditation, use prayer, whatever that will give you a sense of connected outside your body, outside your emotional state. So that is important. So kung meron ka sense of purpose, sense of gratitude. Kasi mayroong study na ang tao, at the end of the day, mayroong grupo na sinabihan, okay, name 5 things that you enjoy for the day. Tapos ang ginawa ng mga tao, may isang grupo na sinasabi nila, at the end of the day, I enjoy talking to a friend, we had a nice meal, I met a nice friend, an old friend. Tapos may grupo na they don't say anything about it, about what happened with their day. Tapos may grupo naman, they complain about how the day went. Alam nangyari, after 8 weeks or 12 weeks, yung mga taong mga papasalamat have a higher scores of being happy. So that's important. There was a study that was shown, a Harvard study, that I think it was a follow-up of so many people from in their 30s until in their 60s, and they found out that the highest measure of why people are happy is not because of their wealth, not because of their social status, whether they're bankers or president ng the university or marami silang pera. The one that really made them happy is because they were able to connect with people and they felt a sense of belonging, having that kind of relationship with people, whether it be small or big. So what's it called, a feeling of connectedness. So itong gagawin nyo will give you what they call a coping, you can call it coping, or you can call it a healthy measures to be able to see this COVID-19 more of a challenge, not a threat, not nakakalungkot nga, nakakatakot nga. Pero if you look at it and say, we will overcome, we shall overcome, we will be able to look an opportunity out of this challenge, out of this particular crisis, and say to ourselves, how can I make this crisis become an opportunity for me to be better? Marami din nangyayari sa crisis na ito. Pero sa Pilipinas, this crisis, wala na nangyayaring pasasang kalokohan. You know that you spend more time with your wives, or with your wife, not wives. Pero ang point ko, we have to tell ourselves that there is a thing as we can take hold and control of what we go through. So I think I will have this, and our classmates, if they have any feedback, any questions, I'll be glad to address this issue. Maraming salamat sa inyo lahat.
Maraming salamat, Jesse. At we now turn to our audience. If you have any questions, please don't be shy.
Wives, Jan. You want to join? That's true. What Jesse said. You know, the sense of isolation is can be very, very harmful to one's mental health. You can be around friends. You can be around people. You can be around all things that are making you feel one should be feeling good. But if you're depressed, your point of view changes. It's distorted.
Mhm.
You feel
Yeah.
isolated even if you're around people and friends and family. And that's what drives people sometimes to have a sense of futility. They don't see anything bright for the future, and that could lead them to suicide easy. Am I correct, Jesse?
So, Doc Lucy, Doc Jesse, so it's better to be anxious rather than depressed.
Yeah.
No.
That's right. And it's better to take it early on. Alam mo, meron early on, being a child and adolescent psychiatrist, aside from being an adult psychiatrist, we start seeing that in children and adolescents. Hindi lang natin na-identify, you know, but anxiety and depression is not an uncommon thing that happened in early childhood, either from trauma, from familial or genetic predisposition, home situations, traumatic experiences. Divorce is very common here in the United States, and they most children and adolescents, when their parents divorce, they blame themselves. They always think, did I do something to cause the divorce? Did I do something bad? They're always thinking that they're at fault. And if that happens, then they become very depressed and isolated. And what are the signs in teenagers and children? First, first they isolate themselves. Second, because they cannot identify what's going on, they become somatic. Nagko-complain, masakit ang tiyan ko palagi, masakit ang ulo ko, dadalhin sa mga doktor, walang makita. Another one is their grades go down, their performance in school go down, or they stop enjoying things that they used to enjoy. They don't want to attend dance classes, or they don't want to go to their practices of their team. All of a sudden their personalities change, and there are personality profiles that make them prone to that. Those yung mga bata at saka adolescent na mahiyain are more prone to develop anxiety because they're more vulnerable. Kaya yung mga mahiyain na mga batang ganyan, they need to get reassurance from parents. They need to get reassurance from their loved ones na you're good. Karamihan dyan, they have a very low self-esteem. They do self-defeating behavior. Palaging kahit na they perform well somewhere else, sasabihin, that's not good enough. You know, I'm really a screw up. I don't perform very well. So those are things those are signals that you can watch for. These are the kids and adolescents that could easily become anxious and depressed later on, and even commit suicide, like Doc Jesse mentioned. You know, when they feel sense of isolation.
Yung ano, ng isang pare, I had this priest was my patient, and he suffered from bipolar depression. Sabi niya sa akin, siya, he also thought about suicide, tapos meron pa siya na nakasama.
Medyo nawala si Dr. Jesse Yang. Um, I have one question, Doc Cusi. Okay. Jesse is back.
Nagginamot ka ng hello, hello? Hello?
Jesse, your connection is dropping.
Oh, I see. Nawawalan ng connection, nawawalan na yata ang baterya, pero can you hear me now?
Yeah.
So I was saying that I had a priest who was my patient who suffered from bipolar disorder. And so for many years when he was a teenager even when he was a priest, he was thinking about suicide despite praying a lot. And only after his chemical imbalance was addressed that he felt no longer suicidal. So I'm not saying that all of these things that we are going through in terms of depression is got to do with biological disturbance. Marami pa rin tayo na depression could be treated with cognitive therapy, with counseling, with meditation. But especially those people who probably went to childhood trauma, so they probably have a history of being violent treated by their parents, or sexual abuse, or a loss of a parent, because that could lead them to a depression. So ito ang sinasabi ko lang, yung depression is a very complex disease, multifaceted disease that initially could trigger by a stressful event, but eventually, if that stressful event is not relieved within a period of time, it can affect the brain structure and functioning, and it can lead to a clinical depression that will need much more radical measures, including therapy, medications, and even at some point electroconvulsive therapy or other modalities. So, but in this case with COVID-19, people there was a study that they made a study of in the last year. There was an incidence of 20% increase of depression as well as anxiety, and that people who have been exposed to COVID, that there was a 6-month study that was published by Lancet Journal that there was a higher incidence of anxiety, depression, insomnia, and cognitive changes such as memory lapses, parang brain fog, makakalimutin, tapos and even to some point may have caused either dementia, delirium, or movement disorders. Ang brain na yan, parang the COVID, when the virus can code to the brain because there's an opening through the olfactory bulb. Merong butas paputak eh. Yung sa ilong, merong olfactory lab, olfactory tube, doon dumadaan ng COVID. Kaya minsan kami sasabi they lost that taste of smell and taste because of involvement of that particular nerve endings. So sa ngayon, kaya there's a lot of incidents of depression because you could see the loss of loved one, violation, sense of purpose, the uncertainty, anxiety, they go together. So anxiety and depression sometimes they overlap, but they are both a very good experience. Anxiety is a fear of impending loss, whether it be real or not real, but depression is also dealing with the grieving over the loss. So both are painful sensation, but initially anxiety could be is also maybe initially maybe neutral emotion, because when you have anxious, you're challenged to solve the problem. So that's the reason why anxiety is necessary, for you to be challenged to look at the problem and solve the problem. So, but if the anxiety is the one that over controls you, then it becomes unhealthy and pathological. Now, sadness, it is human, it's within our human state to feel sad, because we feel a sense of connectedness with people who are in pain, or people who are losing, who are dying, or who are critically ill. We feel their pain, we connect to them. That's why we have what they call the sense of empathy or compassion. Kung wala tayong sadness and depression, paano natin maramdaman ang sakit ng isang ating kapwa-tao? how could we be able to give compassion if we cannot feel the pain of someone else? So yun ang kailangan natin. So if the sadness can move you to take some action to relieve the pain of others, that's a positive emotion that brings you to a certain kind of outcome of being part of humanity. So yun ang maganda lang.
Going back, Dr. Cusi, dun sa sinabi mo, no, na um, the children sometimes feel guilty because of the parents divorced. What if, let's say, there's always fighting, no? There's always fighting between um,
Mother and
the husband and the wife, no?
Yeah.
And is there any consequences that would develop that would
Yeah,
manifest?
yeah, most of the time they identify with either one of them, you know. They have found out that they identify with the aggressor sometimes
Mhm,
because they see the aggressor as being powerful. And sometimes they identify with the aggressor with the mother
mhm,
because the father is kicked out of the house. So they see the mother as being powerful and they identify with that. So they have some form of, it's called identification with the aggressor. So in their future relationships, that's going to be the blueprint. They become attracted to, to partners or eventual future partners who are who can kind of like mimic what they saw in the relationship between their parents. They always use that as the blueprint of how relationships should be. It doesn't happen all the time if if that blueprint is helped early on in therapy. That's why, Dito, I encourage all the families who are going through a divorce, always reassure your children that it's between you and your spouse and not because of the children. They need constant reassurance that they are not at fault because they always blame themselves. Maybe I was not good enough in school. Maybe I was not athletic enough. And that caused them to have arguments. Maybe I'm not washing the dishes or bringing out the garbage can, and those things play in the mind of of the children. They have that victim mentality. They become the cause of the conflicts. So you have to reassure them. So I tell parents who are that's the very first advice I tell family. For whatever reason you decide after you tried reconciling, if you decide to separate and eventually divorce, make sure you keep reassuring. Kasi ang mga bata, they have very short memories. 1 week for them is a long lifetime, because they don't have experience with life yet. So you have to keep reassuring them. It has nothing to do with you. It's between mom or dad and I. So pag nalaman nila yon, they get reassured that my mom, sasabihin ng mga parents, sasabihin ko sa father and the mother, always tell your children you always love them no matter what happens between mom and I or dad and I. You will always be our children, you will always be our loved one, and we will always be there for you to support you. Ang sinasabi ko pa, what I do is, let's say, uh, you have a friend, a very close friend. Eventually, will be times when you don't agree or you don't get along with your friend. Nag-aaway kayo. So sometimes that happens to mom and dad too. So it's not uncommon to find that. That way they won't see that as not as, if you always see something rosy and happy and all the things, they will have a rosy look in life, which is not good either. Dapat makita nila na an argument is part of a relationship. Sinabi ko nga sa mga parents, sometimes when you argue, it's not unhealthy to have an argument because you're trying to solve a problem between the two of you. Ang problema niyan, pag hindi na nag-uusap, ang ibig sabihin nun, they gave up on their relationship. That's why they stopped talking. Merong mga silent treatment na. Pag ganyan na, ano na yan, medyo they're at a critical stage in their relationship. Kasi I don't care. Whatever I say, whatever I do, wala namang nangyayari na. So I'm giving up. What's the use of talking and conversing? So as long as they're arguing, that's okay. Kailangan lang ng maybe a good family therapist to improve. At saka yung mga marital relationships na nagkakaroon ng problema, we send them to marital with a different expectation. Sinasabi ko sa kanila, pag pumunta kayo sa therapist, marital therapist, pag pumunta kayo doon, don't expect that your relationship will be back the way it was before. Sometimes a marital therapy will tell you, is it worth going forward in your relationship? You will have to solve that so that if you decide that this is not going to work any longer, that we need to move on with our personal lives, at least you cannot look back and say, I wish we did marital counseling first. So pagka you went on with yourselves, meron kayong mga agreement na let's keep disagreements between the two of us and not involve the kids. Let's not, when the kids are with us, do not criticize or inquire about what's happening with the other spouse, so that they're not trapped to be in between the arguments or the fight of the parents. Let's separate in good terms. That way, the kids will see sometimes relationships don't work and we have to move on. So hindi lang, because if you always expect na happy and rosy ang buhay, they're in for a big shock when they're in a relationship themselves. Na hindi pala ganon. And then they become depressed. Bakit hindi ganito? Bakit ganito? Hindi ka pareho ng parents ko. Na rosy and happy and their expectation of a relationship is unrealistic.
Any other questions or comments?
Baka tatlo na tayo tira.
Hindi. To our doctors, gusto ko lang malaman, para sa ating mga senior citizens, meron ba mga common signs that we are experiencing that we get anxious and then it goes to depression? Sa stage natin ito, meron ba tayong ganong klaseng experiences?
I can say something and then Doc Jesse can add to what I say. One of the things that will make you see that there is something going on that's not right is when you start changing the way you conduct your daily life. Yung mga dating pinag-i-enjoy mo, let's say I know that there are several of our classmates who look forward to being with each other to play golf, di ba? And then all of a sudden, parang ayaw mo na. Parang nawalan ka na ng interest. All of a sudden, you're losing sight of that. And mainitin ang ulo mo. You get irritable. Small things, this gets you frustrated easily and you snap back at your loved ones. Yung things that they usually say to you, tumatawa ka pa. And all of a sudden, galit ka, nagagalit ka. You become very impatient and restless. Tapos, aside from that, lagi kang pagod. Your sleep is disturbed. Hindi ka makatulog o you cannot maintain rest. Gumigising ka multiple times, not just to void, kasi matatanda na tayo. We usually wake up 1 or 2 times at night to void. There's a difference. Pag nagising ka, kung may anxiety and depression ka, hindi ka makabalik makatulog kasi nag-iisip ka na ano bang gagawin ko, ganon. You're worrying a lot. And then no matter what you do, you toss and turn, hindi ka makatulog, ganon. So sleep is a very good indicator that something is going on with you. And like I said, yung tinatawag nating anhedonia and apathy, wala kang motivation, wala kang drive, the things you enjoy doing, all of a sudden, ayaw mo na, parang wala ka ng gana, ganon. So those are clues. And of course,
Yeah.
mainit ng ulo mo, and then small things make you emotional. Konting ano lang, makarinig ka ng mga sentimental songs, ganon, bigla ka nang iiyak. And then when you're watching
Yeah.
TV, ang nakikita ko, all of a sudden, istorya ko yata yan nasa TV, ganon. Parang istorya ko, parang buhay ko yan You're beginning to relate to things that are making people sad. Parang ganon. Parang istorya ko na yata yan Ganon.
Ito na, naiiyak ako pag may sentimental na movie. Baka may depression din pala ako.
Naalala mo kasi yung mga wives mo dati, Jesse.
Alala ko na bata pa ako. Marami tiniligawan.
Yung madaming
Tama sinasabi nito na.
Kasi si Jesse, maraming pinaiyak yan sa UST, kaya ganyan.
Akong pinaiyak. Anyway, tama sabi ni Tunet. Pag tayo yung tumanda, so we are probably, all of us are now in the last phase of our life, right? So we are in our 70s. So maraming dumadaan sa atin. Number one, alam natin na malapit na tayong tawagan ng Panginoon. Number two, ang ating mga anak ay malalaki na at meron silang mga sariling anak. So they feel that their sense of priorities have changed. They're much more connected to the children than to us. So meron tayong parang essence, parang emptiness. Wala na sa atin, bihira tayong dalawin. So meron tayong parang a sense of what is our purpose? What is our, ano ba bang ating magagawa sa buhay natin na para magkaroon tayo ng parang a sense of contentment, a sense of living. So number three, kung meron kang chronic pain, meron kang arthritis, meron kang sakit sa leeg o sa buto. So pain is a very depressing condition when you have to live with it on a day-to-day. So number four, kung namatayan ka na isang mamahalin mo, namatayan ka na, nabiyuda ka o nabiyudo ko, tapos namimiss mo yung taong minamahal mo, o namatayan ka na isang kaibig matalik, that may be another thing. Tapos ang importante sa lahat is if a sense of purpose, a sense of value is not there. Kung meron ka pa rin a sense of value, you feel a sense of meron ka pang halaga sa mga kaibigan mo, sa mga kapatid mo, sa mga anak mo, you feel connected, you feel valued, you feel appreciated, more likely you will be able to enjoy life. So yun ang ating so the main thing is that how do we look at life when we become older? So do we look at life with contentment, with gratitude? Kasi kung if you live a life of ang sama ng loob mo sa ibang tao na nasaktan ka, magkabiyado ka, more likely you will be unhappy the rest of your lives. But if you say to yourself, ito'y hindi ko na pwedeng baguhin ang nangyari sa akin, sila'y nagkasala sa akin, but if you let go and tell yourself, if I continue to remain depressed and unhappy, sila naman na hindi man nararamdaman nilang ang sakit na ginawa sa akin, so they will not feel the pain that they have created on you. Ikaw rin na lalong magkakaroon ng pain. So if you have the opportunity to let go of the things that has happened to you that done by other people, that will help you out. Number two, contentment. Ang number two is contentment, kasi kung ikaw sagana sa buhay mo, whether you're not that wealthy, whether you're not that healthy, whether you have few friends, but you say to yourself, I'm happy, and then you feel yourself that ihanda mo sarili mo na harapin mo na yung Panginoon. If you believe that, if you have faith that there's afterlife, and you do your best to live with the 2 Great Commandments, you probably will be happy. More than like, di ba? Sabi nga, even the Dalai Lama, sabi nila, the source of contentment is basically to be at peace with yourself, not to be able to make other people happy, but to find the inner peace within yourself. Kaya number 4, iwasan natin ang situation na it will give us more discomfort and pain later on. Sabi nga ng Dalai Lama one day, you know what? When you are about to do something do not ask this question, what is the greatest pleasure that I will derive from doing this? But rather, what is the greatest pain that I will derive from doing this activity? In other words, bago mo iisipin kung anong makuha mo sa gagawin mong ito, kung alam mo there is a chance it will give more pain for you or for someone you care about, that will prevent you from doing certain things that you think it will give you immediate pleasure, but it can give you a lasting grief later on. So a very good conscience, at peace with yourself because you're honest, at peace with yourself because you are not, you don't have any sense of grievance or hatred or anger, yung mga negative emotions. Kung papatan mo ng humility and kindness and forgiveness, I have never seen someone who has that feelings of kindness and forgiveness and non-judgmental attitude toward who will tell me that they are depressed. But if you meet another person, maraming gabyado sa banto, lagalang payayaman, kung paano pa sila makaroon ng maraming kaibigan, kung paano sila become number one, those are the likely discontented, ambitious, are likely to be depressed because they're looking for something that will never come to them, what we call happiness, because they're always craving for something. But if you're contented and you're humble and you're kind and you're forgiving, you're more likely to be happy even when you reach in your golden years of your life.
Sana ang tumawag sa atin, Diyos. Baka may ibang tumawag. Yun ang nakakatakot. Yun ang nakakatakot. Kaya, like you said, alam mo, ang India at saka ang Buddhist, they're very God-oriented too, very oriented in their principles. Kaya ang symbol nila is a wheel. Nakita mo yung wheel, yung wheel, yung wheel ng chariot. Ang sabi nila, pag you put your life in the spokes, yung mga spokes ng wheel, pag umikot ang buhay mo, merong pababa, merong nasa taas ka, merong pababa. So ganyan-ganyan ang buhay mo. But if you put yourself in the hub, yung sa gitna, kahit na forward or backward, laki kang nasa gitna. Wala kang up and down. And they believe that to do that, you have to center your life to God. That is the center of the wheel. Kaya ang symbol nila is a wheel. Always remember, put your life in the hub, which is God. Kung lahat ang centered, your life is centered on God, you will know you won't have ups and downs in life. Yun ang turo nila na it's a very beautiful teaching.
Alam mo, I think tama yung sinabi ni Jesse. The way I look at it is, at our age right now, it's just a matter of continuing to do what makes us happy, di ba? Dito sa Canada, na nagugulat ako pagdating ng winter, kita mo karamihan ng tao rito halos depressed. Dahil because of the weather, hindi lumalabas. Pero siyempre, kami naman hindi. Kaya winter yan, kaya summer yan. Labas, activity. I mean, what makes you happy? Kasi ang nakikita ko sa kanila dito, pagdating ng winter, talagang nasa bahay na lang yan sila. Hindi na lalabas yan. Kaya during winter time, dito yung mataas ang incidence ng nagpapakamatay. Yung tumatalon sa subway, marami yun dito.
Sunlight plays a big part. Kasi ang sunlight, yung exposure to light goes through our eyes and changes the chemistry in our brain. Kaya madami rin sa mga malalamig na country with shorter days. Pag winter, ganon. Sa Alaska, kasi doon, kuminsan, puro gabi lahat. 24 hours gabi. I remember we have a friend from Denmark. Bumisita kami mag-asawa, wala pa kaming anak. Pumunta kami doon. September yon pero malamig na. Nagising ako sa gabi, early morning, puro puro sirena. Sabi ko, sinong mga pulis yan? Sabi niya, hindi, those are not police sirens. Those are ambulance sirens. Many people try to attempt and kill themselves during this time.
Totoo yun.
Kaya puro para sirena doon. No? Sabi nila, puro the incidence of suicide goes up during winter. Kasi kulang sila ng sunlight exposure. So may treatment dito na alam ni Doc Jesse ginagamit namin ng light therapy. If they have seasonal depression, meron dito na a special lamp. You get exposed. Yung tinatawag naming pre-advanced daylight. Let's say, ang wake up time mo, 6 o'clock, ilalagay mo sa timer ng ilaw na nakatabi sa kama mo, ilalagay mo 6:30, half an hour before you wake up. So, na-expose ka sa light way before you even wake up. So, when you get up, medyo cheerful ka. And then you can extend it to 1 hour. I've used it to some of my patients. Lalo na yung they were assigned to Alaska, and they have seasonal depression. Marami dito na ganyan. So it's not recognized very much yet, and they're missed as having seasonal.
Ang tawag doon ay seasonal affective disorder. Tapos ang problema diyan kasi light stimulates the release of serotonin, and serotonin is one of those components that will affect your mood. So ang mga taong may winter depression or seasonal affective disorder, they tend to eat more, they tend to sleep more, they don't have any drive or energy to do things. So sila para silang nag-hibernate, parang bear. So the way you deal with that is, as Tonet said, is what they call, you use a light therapy. I think it's about 25,000 lux. Itong ilaw natin sa bahay, hindi pwede to, kulang to. So you have to buy a special light therapy, siguro mga few $100s. And then the patient is about 6 inches away, or the light should be about less than 1 foot away, and then it should be eye level yung ilaw. You don't have to look at it. You can read a book while looking at it, and so that will help you 1 hour in the morning, or sometimes you can do it at nighttime if you are working during morning. Pero totoo yan, meron sa singas what they call seasonal affective disorder or winter depression. Kaya lang, I have to tell you that I'm gonna running out of my battery, so kung may tanong pa kayo, I'm only at 20%. Kung may tanong pa kayo sa akin, let me know so that before I run out of the battery. But may tanong pa sa inyo ba? Tonet, you're very good. You explain very well anxiety depression. So I think I will learn from you, and I think our class have learned. But you can ask any questions now before I have to recharge my battery, recharge my cell phone again.
Well, thank
Ako
you.
may question. Yeah, can you hear me?
Yeah, go ahead.
Yes.
Yeah, go ahead.
Because of this pandemic, marami ako mga kaibigan na tingin ko para bang napapraning, and I'd like to help them in a way na before lumalabas, before nakikita-kita. Pero because of this pandemic, tatanungin mo, lumabas naman tayo? Hindi, ayoko. Sabi ng mga anak ko, delikado raw eh. In spite of the fact that they have been vaccinated, para bang akong aawa sa kanila in a way that we are on the twilight zone already. We should be enjoying our lives. Kung aanuhin mo yung sarili mo, di-deprive mo yung sarili mo na ginagawa mo before pandemic, parang naano ako sa kanila, sayang naman. Ang sa akin, enjoy mo. Just follow the right protocol. Lagi ko sinasabi sa kanila, pare, protocol ka lang. Huwag ka lang mag-ano. You should know how to. Pero hindi, ayoko. Would you believe kagaya ng pisan ni Tito Martinez na klase natin ito?
Much namin sa prison.
Pisa niya na neighbor namin dito sa San Bagi. Alam mo yung pisa niya, hindi lumapit kay Tito man lang. In a way na siguro mga 10 meters away ang layo nila sa other. Samantalang kami nila Tito, magkakasama kami doon sa bahay ko. We are enjoying ourselves. Nag-aano kami. E naawa ko doon sa mag-asawa in a way na dati lumalabas, ngayon hindi na sila lumalabas. Parang they were greatly affected by this pandemic na sabi ko, kung konti na nga lang ang buhay natin, ayaw nyo pang enjoy to the max. How do you, ang question ko is, what to tell those people that, na maibalik yung kahit na hindi 100%, at least 80% of what they're doing. And most of them are completely shut down.
Mahirap yung tanong mo kasi maybe they've been nakita nila sa television, sa radyo, sa people who died, the pain of dying, nakita nila yung hirap huminga, intubate, tapos and there are stories about people who have been vaccinated and they get sick and they die. So the sense of the fear of death really is a very strong factor for people to stay away from getting out of their house. So siguro the only way I can think about, baka pwede mo nang gawing increment. Kunyari, kung kaibigan mo hindi makita dahil kasi nga takot na takot, then why don't you have meron kayong virtual regular meeting, or maybe you can play board games sa virtual o kaya things that karaoke virtual sa mga, in other words, it may not be that you have to do what you normally do like golf or pasyal because maybe they have this kind of sila mahawa ng tao na hindi naman ikaw, pero if they get the sick, they may die. So the fear of death really overwhelming for them. So maybe pag nag-usap kayo, madalas, regular, and then eventually they let down their guard, maybe you can ask that question, bakit Tito, sino bang pare ito na napansin ko ba, ayaw mong lumabas, ano ba talagang nababahala sa iyo? So maybe they can open up to you and maybe you can tell your experience, but there always a risk that when you go out there is a chance that you can get sick. So maybe that's the reason why people are not willing to take risks because the fear of death or the fear of loss of someone. But it can, kaya nga minsan, ang problema kung if fear of rules your life, you will never be able to appreciate life itself. So, but you have the right thinking, you're fully vaccinated, you have social distancing, you wear masks, so you're taking all the necessary protections, but it's not 100% guarantee na hindi ka rin pwedeng talaban ng sakit, pero you are thinking that you want to have a what you call to take control of your life by as much as possible making life still realistic as it is, even though there is some adversities going on in our life right now. So it's a matter of attitude. Pero kung itong kaibigan mo ay talagang mahal na mahal mo, siguro kailangan pasensya, maaaring gumawa ka ng activities na may not involve direct meeting, pero eventually, maybe at some point, maaaring mag-meeting kayo sa kailan dalawa, walang makasama ibang tao because you feel safe, you're vaccinated, o maybe konting tao lang muna, may ayam sa bahay mo, o ayam sa ibang bahay na talagang kayo lamang. So dahan-dahan, parang incremental change.
Akala ko, I thought you were asking about, you were alluding to one of our classmates who just got surgery with their eyes. That's why. Nagtatago. One of the suggestions that Jesse made is some slow exposure. Sabihin mo, bakit hindi tayo mag-meeting outside? The possibility of transmission is much less when you do activities outdoors. You know? And so, pag alam... Oo.
So kayo, bakit ako? Lagi ako pinapalabas ng commander ko. Ako kusumi sa akin eh. Sabi, lumabas nga, ako kakakusumi ka.
So I think you reassure mo na let's do outdoor activities. The chances of transmission is much less. It's scientific na konti ang transmission. Pagkatapos mag-social distancing, you know, mag 6 foot tayo, itong sa yard ko, ito, pag nakaupo ka dyan, nakaupo ka dito, mag-share tayo ng pagkain, pero we social distance, we can talk. If you want, maglalagay ako ng mask or face mask or something like that, you know, and then And so pwede tayo mag-usap dahil naka-face mask, ganon. At saka 6 feet. The possibility of transmission is almost zero when you do that, when you do those things. And at least nakikita ko eye to eye. And those are the things you can suggest. And ganon. O you can watch TV. Kasi ang transmission is much less. Kung hindi kayo nag-uusap masyado, you just share one activity, one step at a time. Sabi nga ni Jesse, slow exposure. Iba naman yung kay Tony Chongko. Ikaw naman.
Ako yung magpapaalam na sa inyo. Ha?
Sige, sige, Jesse. Keep in touch.
So Arriba Letran sa inyong lahat. I hope to see you again one of these days or maybe reunion next year sa Manila Hotel. Yung mga natalo sa Biden, maganda na. Magpakain sa Manila Hotel.
May utang pa kami. May utang kami.
May utang. Dodoble natin utang nyo.
Jesse na next Minister of Mental Health sa next administration, ika-campaign natin na siyang to be named.
I will just advocate for mental health and healthcare. Yun ang aking to help our countrymen in our small ways, Tulungan natin ating kapwa Pilipino.
Promote ka namin na
Pero masabi ko
maging
lang,
Oo.
ang mental health sa Pilipinas hindi masyado. Hello to everybody.
Baka facial ka pa. Tatakot ka sa amin, ha? Ayaw mo mahawakan ka.
Hindi.
Alam ko na surgery ka. Alam ko, video lang kita.
Oo. Naka-ano ko eh. Alam kong gwapo ako kaya naglagay na ako ng
Sabi nila, nagpa-opera ka lang, pinalis mo yung eye bags mo.
Oo. Yan,
Kaya
nakikita ko na. May nakikita ako diyang kasama nating babae. Si
Si Nikki.
Si Nikki, anak.
Anak
Ni Tokayo.
Anak nino? What's your name, Nikki?
Yan,
Ay,
Anak
mapaalam
po
na sa inyo,
Tony
ha?
Chongko.
sige.
Anak po
Yan,
ni
ha?
Tony Chongko.
Anak ni?
Tony Tiongco.
Tony Tiongco.
Ni Tony. Good.
Apo.
Nakita nyo na, nasubukan yun. Ang bilis ng mata ngayon.
Oo.
Bagong operasyon, nakita ka
Alam
agad.
naman ako, pagka magaganda, nakikita ko kagad eh.
Ang bilis. Bumilis ng 100%.
Buti, hindi nagmana kay Tony. Oo. Buti na lang, magmana ka sa nanay mo, Niggy. Oo. Si Jesse nawala na? Wala na si
Hindi,
Jesse.
nandiyan na.
Thank you, ha? Thank you, Jesse. That's a nice talk, ha? And
thank you
I
very much.
appreciate that.
Very
much.
Be willing to do anytime to talk about a thing that tonight and I can help so I'll be glad to be there for you. Okay?
Sige.
Sige.
Okay. Pero
See you next year.
maganda ka doon sa blowout ng ng mga sa Manila Hotel, ha?
Wala na yun. Wala natin yun. Basta magkita-kita lang tayo, mag-enjoy tayo.
Oo, dapat. Yun ang pinakamasarap.
Magkaraoke
Hindi,
tayo.
masarap naman yung may kantsawan eh.
Punta tayo sa Dusit
Always
Hotel.
is.
Kainin ng lechon, sabi ni Andy. At magkaraoke tayo.
Oo.
Jesse, Jesse, November next year, Emerald tayo.
November next
Emerald
year.
na tayo.
We will be there.
Next year, ha? Emerald.
Next year,
55.
Emerald tayo.
55.
We will. Nga pala, Emerald tayo, no? Saan tayo gumasa? So we have to figure out how we can spend a few more days. Either get together, breakfast,
Ituloy
resort.
natin yung, kung pwede, ituloy natin yung November.
Oo, tuloy natin.
Tuloy natin November.
November next year.
Oo.
So,
And before you log out, Jesse, let's have
Christmas get together even by Viber.
sige.
Maghanda kayo ng mga pagkain para we enjoy together eating with each other.
Okay,
Just
pwede
get
kasi
up your
yung sa anak ko
Viber.
tama. Let me know about Christmas Eve yun, di ba? Christmas Eve ba? Christmas Eve.
Ang ano kasi 20 ang Saturday dito 25 eh.
Oo nga pala, no? Sa inyo, kayo pala mauna, advance pala kayo sa
Oo,
amin.
kami mauna. So,
Oo.
would it be possible to make it instead na ang meeting natin Saturday, let's move it to 27 na ano? 27 dito, 26 dyan sa inyo.
Oh, sige, pwede
Para,
yun.
ano,
Ano naman ako eh.
sino ba ang hindi pwede sa Pilipinas ng 27?
Teka muna. Before we open all our mics, bigyan
Okay.
natin ng masaganang pasasalamat si Dr. Cusi sa si Dr. Ang.
Okay.
No? And of
Sige.
course, si Dominic, no?
Dominic, of course.
For participating, and I think we learned also from her, no? Doon sa mga situations diyan sa Pilipinas.
Sige.
Maraming salamat, and I hope
Okay.
this will not be the first and the last.
Okay. I'll keep in touch.
Thank
Okay?
you.
Keep in touch. Thank you
Okay,
very
so-
much. Thank you.
Everybody,
Salamat.
Thank you.
everybody can
Bye-bye.
open their mics.
Bye-bye.
Nak, Dom.